China says the number of people infected by a mysterious respiratory virus has more than tripled over the weekend.
This virus doesn't discriminate. It attacks everyone.
So in a way, COVID-19 was predictable. In fact, it was foreseen, but for some reason, it wasn't planned for. Well, we celebrate our 10-year anniversary, and this is really the topic at this time is looking back, looking forward, is really taking stock of what we've learned over 10 years. This is a discipline that has evolved dramatically. And then looking forward, where are we going? What more can we learn? And how can we have bigger impact in the future? I can tell you as a practitioner, one thing that is striking, one thing that you learn very early on in your career when you walk through the site of a major disaster is how much of it could have been avoided. I've seen quite a few leaders and even officials freeze right in front of the crisis. And the truth is that communication is key during a crisis. And so our hope is that this session will give a couple of pointers to leaders, to experts on how, when, and what to communicate when a crisis emerges. The topic is so rich that we decided to structure it in three sections. The first one that focuses on best practices in communication when the crisis emerges. A second one focus on the duration of the crisis. When you're in the middle of the crisis, how do you continue to communicate with the public or with a variety of stakeholders? And finally, a third section really focuses on protracted crises that last a long time, like the ongoing pandemic, but also how to communicate to address the trauma that come with long-term crises like the one that's currently unfolding. There's so much more that is now available and that is being used almost every day. And yet there's still so much that is coming. There's artificial intelligence, there's the Internet of Things, there's new satellite coming up every day. But we also, over the years, have learned more and more about how to communicate. And now we integrate this dimension of crisis communication. I think it's going to be fascinating. And I think it's a journey that's still going to continue for quite a while. What can we do once a risk is identified to communicate so that it's acted upon?
Welcome to this session on risk and crisis communication in the era of COVID-19. The usual business of understanding risk is natural hazards and natural disasters. But it's impossible to talk about understanding risk in the year 2020 without looking at COVID. And impossible to look at the risk that COVID has posed without looking at cities where much of the impact has been felt. And so I'd like to start by introducing three speakers from different bits of the world to share with us their experience and their expertise on communicating risk in the context of COVID in cities. Dr. Jo Buford from New York University. She's a clinical professor of both global public health and of pediatrics. She's also the chairman of the board of the International Society for Urban Health. Jo, welcome. Next, I'd like to introduce Dr. Vernon Lee from the Ministry of Health in Singapore. He's the Director for Communicable Diseases and a specialist in infectious diseases. Thanks for joining us, Vernon. Mr. David Grossman from Buenos Aires. He's the General Director of Strategic Management and also the Chief Resilience Officer for the City of Buenos Aires. He's also on the Global Steering Committee for the Global Resilient Cities Network. David, welcome. So here we are in New York, in Buenos Aires, and in Singapore. Three very different cities, but all struggling and in some respects succeeding in coping with the massive challenge of COVID. Let's just begin by taking stock of where we are. Jo, how are things in New York right now? How is the city coping?
Well, we're being very careful and very vigilant as the sort of initial epicenter of the epidemic in the United States. We had really terrible outcomes initially in the spring. And so I think we have really been on the school of closing down and then opening up very gradually while tracking incidence rates results, as well as now through testing and tracing, trying to identify and intervene in hotspots. Most of the services are open again at reduced capacity, reduced hours. And we're watching the numbers, been set at about 3% on the positives on the testing, and we're around 2.4, 2.6, but so far the schools are open, and we're sort of closing around 10 o'clock at night, and people are really conforming and hoping that this can be managed while we move forward in a more normal way.
What's the feeling like in the city at the moment? I mean, are people nervous? Are people anxious?
I think the major issue is the uncertainty. I think people with children in school not knowing if the schools are going to be closed one point or another, people with businesses watching vigilantly to see if their business is going to be able to stay open literally almost from day to day or a couple of days. I've lived in New York for about 40 years. Off and on, and I think the city's wounded in a way that I haven't seen before. It's especially, I think New York is a city of neighborhoods, as most large cities are, and the loss of small businesses has really been a blow, I think, to our sense of identity and our ability to create smaller connectivity, smaller neighborhood connections within the city during something like this, when it's really quite important. So it's, I think the feeling is still, we're coming back, the activity's beginning to pick up again, but it's still not what we're used to.
David, what's the mood like in Buenos Aires?
Thank you, Olivia. Well, in Buenos Aires, began to slow down the cases 2 months ago, and the city began to switch it on. A lot of activities began to open, shops, schools, very little, just a little moments to meet each other between the students, but not so much. And the scholar year is ending in 2 or 3 weeks, and they only could meet once or twice in all the year. This is maybe the most difficult situation for the children, for the kids, and for the elderly population. But the city is in the race of switching on the most of activities.
Vernon, I'm also in Singapore, so I mean, my impression is that life is really getting very close to being back to normal. But what's it like when you look at this from the expert's point of view? Is it really like that?
Well, thank you so much. So, I mean, indeed, I think, we're quite fortunate here in Singapore that, our community, case numbers are at quite a low level. I mean, basically hovering around about 0 community cases at the moment. We had our sort of circuit breaker, which is a form of some, social controls that we enacted in April to June of this year. And that has really brought down the numbers quite substantially. And right now, even as we open up society and the economy, there are more activities restarting, and people are going out and about their lives in the sort of what I call the new COVID normal. I think people are adapting to, taking, sort of safe measures, such as, wearing of masks, having, physical distancing, and also good personal hygiene and social responsibility. So I think there's that sort of balance that we're trying to achieve, allowing society and economy to open, and yet through various means, like some of the safe management measures that I've talked about, and also increasing our capacity for surveillance, laboratory testing and detection, contact tracing, to keep case numbers as low as possible. So it's a fine balance that we are trying to achieve, and so far, it has borne out quite well. But we know that, it's quite a long road ahead, and we have to keep, on top of our game and on our toes as well, because the virus is always looking for opportunities to spread. So we have to do our utmost to keep it under control.
Thanks, everyone. Vernon, can I stay with you for a moment to ask about how Singapore prepared itself for the crisis? Now, one of the perhaps advantages, in a weird way, that Singapore had was that it had gone through the SARS crisis in the early 2000s. To what extent do you think that that helped Singapore to be better prepared for this one? And also on a personal note, I know that you've worked on other influenzas, highly infectious diseases. To what extent do you think that those were, in some sense, useful learning experiences? And do you think there's a sense in which each crisis is different and there are still new things to learn and to adapt and to cope with each time a new infectious disease comes around?
Certainly, I think no two crises and no two infectious diseases are going to be the same. SARS was quite a learning experience and a very steep learning curve for us. I mean, it was we were facing an unknown disease at that time, and really challenged us. And I think through really working together across various agencies and also with the community here in Singapore and also with our international partners, we were quite fortunate that we kept SARS under control in a matter of several months. But we don't rest on our laurels. I think we use the experiences that we've built up through SARS to know that we need to anticipate things that we, anticipate the unknown, and to come up with sort of crisis preparedness and management strategies that are flexible enough to deal with, whatever situation that we might be faced with. We've been testing these preparedness plans through, annual exercises across, various components of both government and our society. And also we have been strengthening these preparedness plans as we face with different pandemics. For example, the 2009 H1N1 pandemic. We were prepared for, diseases like, MERS, Ebola, even influenza, which thankfully we didn't see any of these cases. But just last year we had a case of monkeypox in Singapore. So this really helped us to roll out some of these preparedness plans to keep them warm, and also to learn from each experience to modify the plans and to strengthen them depending on the situation.
That's interesting, and maybe we'll come back to some of the specifics of that later in the discussion. But Joe, could I turn to you and ask, how prepared was New York? I mean, I think New York had a pandemic response plan. Did that roll out? Did that come into play? And were there any experiences that New York was able to draw on which helped it to prepare for this?
It's an interesting question. I mean, I think the New York has a very sophisticated emergency response mechanism, which, as Vernon said, practices all the time. I think the tendency had been that it was more designed around some natural disasters, like Hurricane Sandy was the most recent we had, or 9/11, obviously a terrorism incident. So it was a very specific action, tangible, visible activities. You mobilize, you get everyone together, they work collaboratively to address the problems that have arisen. I think part of and of course we had Ebola, but it ended up being really quite a small factor for most people in the city. It was a significant fear factor, I think, but the reality was it was quite a small experience. So I think the uncertainty in COVID, the lack of clarity about the nature of the bug, what one should really do, the mixed messaging I think that we were getting, obviously in the United States, it was a serious problem from the federal government to state government. And then the experts were also being influenced by politics in a way that I've not seen in this country. So I think the messaging was difficult. It reminded me in interesting ways about the HIV epidemic in the 70s at the beginning. I mean, we didn't really know what this was and how it was being transmitted and what was going on. The difference, of course, is it was, in the end, much more limited in terms of transmission, not aerosols, not in the air. So I think we're very good at mobilizing the healthcare system. I think very good at mobilizing the sort of messaging and trying to connect to communities. But the real issue here, I think, had to do with the population health, the need to talk to the entire population and the need to deal with the prevention question, the issues Vernon mentioned. I mean, this is not, our public health infrastructure has not received significant investments in the United States for many, many years. I'm not talking about publicly funded healthcare. I'm talking about the local health departments and sort of public health professionals. So this was a wake-up call for us that that was really necessary. And I think the degree to which, how do you mobilize local health departments and state health departments? Because in the United States, the states really have the authority over public health. It's very interesting. I think people may have thought, how weird is this that the national government has to invoke a national defense requirement to get states to collaborate, but that's the way our system has been designed since the 18th century, basically. So I think that's that whole problem of communication, coordination, and synergy has been a real wake-up call for for COVID that we had not experienced before.
Very interesting. And I definitely want to come back to that issue of coordination between multiple layers of government. But first, David, could I ask you, did Buenos Aires have some plans in place which it was able to evoke as the crisis developed? Or was it a matter of trying to develop strategies on the hoof as it was starting to come closer to Buenos Aires?
Well, for over a decade, Buenos Aires had developed a meticulous administration structure based on evidence, planning, and monitoring in a whole. This structure is especially crucial in facing any crisis, since it allows the government to rapidly adapt to threats, design a containment plan, and implement it. Furthermore, it allows thinking beyond crisis management and addresses the consequences of the day after the crisis. In particular, in the COVID-19 crisis, they had another advantage, and this was the time. We had the opportunity to learn from the experience of Asia and Europe, and we knew what would happen if we delayed our response, and we took the threat seriously and set in motion a comprehensive response that needed the commitment of American government and citizenship alike. So for the first time in 13 years, we had to quickly reorganize ourselves and operationally and in terms of policy. And we were able to do this precisely because of our long-standing experience in centralized planning. Once the new scheme was sketched out, all the pieces fell into place. And thus, we reorganized our government into three strategic pillars: the crisis management, which oversees policies and sector strategy to guarantee the provision of essential services such as health, education, and security. Second, government administration, which ensures all the other daily tasks of government, such as the maintenance of public arts and the planning of streets. And third, the day after, which is responsible for forward planning and understanding how our city will change when we come to switching it back on. And once we implemented a comprehensive public health program and strengthened all its mechanisms for detection, isolation, as well as contact tracing, we decided to switch the city back on. As I mentioned, we started working on this plan as we respond to the crisis and in collaboration with experts for the private and academic sectors and civil society. The plan includes a comprehensive approach to well-being and is based on the responsibility behavior of society. In addition to epidemiological and health indicators, it takes into account new dimensions such as physical, mental, spiritual, and emotional well-being, and returning to work. It is deeply rooted in a step-by-step evidence-based approach based on how the data evolves. It follows the principles that the new normal demands. It is based on citizen responsibility and evidence-based data. It prioritizes children, adolescents, and young adults' education. It redoubles our efforts toward closing gender gaps. It strengthens our commitment to a city on a human scale that is resilient, sustainable, inclusive with a solid climate agenda, and it brings together strategic actors for the reactivation and recovery, such as the private sector. Our policy and decision-making methodology has given us the flexibility to adapt the government apparatus quickly, therefore developing responses that are consistent and coordinated. building our management capacities over the years has demonstrated to be the best investment in the future of our city, not only in facing COVID-19, but in becoming a resilient city prepared for the next challenges we will face, either social, economic, or climate change related.
David, I'm wondering if one of the challenges isn't, when it comes to COVID in comparison to a flood or an earthquake, one of the problems is deciding when it's a crisis. And if I understand correctly, in Buenos Aires, the crisis and the response to the crisis was defined rather early. And I wonder whether that isn't a challenge when it comes to communication, telling people that you're in a crisis when they don't yet see evidence of it themselves. How did that issue play out in Buenos Aires? Was there agreement amongst different layers and parts of government about announcing, defining a crisis, and then moving forward with your crisis plans?
Well, as you mentioned, we had to learn in the way. And first of all, we closed all the activities, and then we began to learn and to see what other cities were doing, and really was like a learning process, and we have to begin to communicate daily with the to make a communication plan, to a crisis of communication plan, and the Ministry of Health began to talk every day based on in the morning, at the first time in the morning, with a lot of evidence, and the mayor began to make press conference every 15 days to communicate the new open activities during that are going to happen in the next 2 weeks. In the complementary, we launched 2 or 3 different platforms to put the information available for all the citizens and the civil society. Platforms on open data about the cases, about the number of deaths, the number of cases, the number of tests, and in the same time, we put another platform available for the citizens about the procurements, the procurements that the government make every day about the COVID. You know, because of the urgency that the government had to apply, buying things that wasn't planned to be during the year. Well, we had to make an organized communication plan that was going on during the crisis.
Joe, may I ask a similar question to you? Was there, or how much coherence was there in terms of sort of defining the start of the crisis? And you've already alluded to the challenges in a federal system in which you have the municipal government as well as the state government and the federal government, all of whom have a role to play. How did that help or hinder things in New York?
Well, I mean, I think it's been pretty obvious in the global press that it hindered. You know, I think one of the premises of this conversation had to do with the notion of the sort of, there's 2 questions really. One is sort of the trust in government in general in a particular country, and then the degree to which there is a sort of set of understanding of central control or central direction. The United States is never, I think we are not a country that's well known for high trust in government because people are very independent by nature, and they have a lot of their own views, so that sort of the confusion of the federal, in this instance, the federal, state, and local, just to a lesser degree in New York State, I believe, and I'll come to that in a minute, you know, didn't help that, because then it's sort of reinforcing the notion you can't trust government, you can't trust them to give you the right, the right information, because it was quite conflictual. I think that another issue in a city like New York, and I'm sure in Singapore and Buenos Aires, is the the media is everywhere, and the messaging is all over the place. And depending on the sources that different parts of the city or communities are using for their information, that really can exacerbate quite strongly the clarity with which messages are being given and the degree to which people should take Vernon's notions on board and do the basics in terms of public health, which I think finally did get through. We were fortunate, and I think Governor Cuomo deserves a lot of credit for stepping in the face of really lack of clarity and leadership at the federal level in the way that one would have hoped, let's put it that way, by having really daily press conferences and sharing what he knew and what he didn't know, and really became almost, shall we say, must-watch television for anybody in New York and many people around the country to try to get a sense of what was happening and the scope. And the last thing I say about New York, I mean, it's sort of, we were on the front lines. David mentioned they had a chance to watch and learn what was going on in other cities and adapt their plan. And I think while many people in the United States, led from the federal level, were watching China and the western part of the world, the virus was actually entering New York through Europe. I mean, we didn't know that until several weeks later, but certainly people who'd had contact or otherwise. But it was a very emergent activity, and I think the political leadership became a really crucial issue, both for positive and at the national level, not for positive, frankly, in the U.S. response. But this, public health is a political reality in many cases, and I think COVID has revealed the many layers of the truth of that statement, and the leadership is really, really important. I mean, one is the structure that allows you to lead, but also the individual who's in the role and has the authority to really invoke and manage the crisis.
Absolutely, very interesting. Vernon, could I ask you, I mean, the Singapore government, the Ministry of Health has also been extremely open in providing detailed, very up-to-the-minute information about the number of cases, some details about the individuals, the severity, how they're being treated, and so on. In the context of a pandemic like COVID, is there any sense in which information could be excessive, too much, or is it always going to be useful to the public to have as much information as possible, as quickly as possible?
I think in this day and age where there's of course a lot of information being shared on various platforms, and social media is one of those platforms that we have to deal with now in terms of communications and transmission of information. I think it is important to put out the right information in the right amounts. I think it's really difficult to say if something is too much or too little, but we certainly would like to put out information as fast as possible and as accurately as possible, because I think in the absence of the void of information, I think people will start either, thinking that, that either is not enough information in one area or creating some sort of misinformation, which is something we want to avoid. So I think the strategy on our part is always to put out information that the public can use to, in a way, empower themselves to do something about it. So we don't just put out statistics, because statistics sometimes it's too technical. We want to put out messages to be able to tell the public that things that they should look out for. These are things that they can do, to protect themselves, protect their loved ones, and to empower them to do something. Because I think empowerment is quite important, so that people can feel that they have a stake in working together as a community to try to tackle this problem or this crisis. Very early on, in fact, we have worked together as a whole of government to put together a coherent plan and coherent messaging, not just in sort of the communications, but in many other fronts as well, so that our response is as a whole of government, as a whole of society. So very early on, in fact, in January, before we had our first case of COVID-19 in Singapore, we set out a multi-ministry task force, chaired by the ministers, to look at a lot of these components of sort of crisis management, crisis response. And I think this has been very helpful in coming up with that collective, coherent messaging, both across government and to the public as well.
And let me stay with you for a moment to talk about this important issue that Joe just brought up about trust. In Singapore, in a way, the government it's off to a great start. In surveys, the number of people who trust the government in Singapore was one of the highest in the world. How does Singapore maintain that? And what do you think that other countries, which don't start from that position, might be able to learn from the Singapore experience in terms of building and maintaining trust?
I think there's no sort of a magic bullet when it comes to building trust. And I think, no two countries are alike as well. So, a lot of local context has to be taken into account in building rapport and trust, whether it's between government and the population or between various different agencies, different institutions trying to work together to deal with a very complex issue here. And one thing about trust is I think it can't just be built overnight during a crisis situation. It has to be built across time through various whether it's in a regular sort of peacetime all the way to the crisis situation. I think one thing is the communication, the two-way communication, to understand what do people actually are most concerned about, and to actually address those concerns. And we do that through running various surveys to understand what are the key concerns of the population. I mean, of course, dealing with the COVID problem as a health problem is one of them. But COVID, as you can see, has transcended the health sector alone to affect many other sectors. I mean, the global lockdowns in many countries, the closure of borders and air travel, impact on society and economy. These are all very huge shocks to the population. So we have to take these into context as well, even as we look at how do we actually control the disease. And that's why earlier on I said it's a very fine balance between controlling disease and allowing the population to open up and to enable some socio-economic activity, because that is important if we're going to have a sustainable control and if we're going to live in this new COVID normal. So that communication and understanding of what the population wants and needs, and trying to address that as far as possible, and also trying to communicate to people on why certain policies, certain actions are done in a certain way. I think that's really important to gain trust. The other, of course, as you have already mentioned, is transparency. We put as much information out there as possible, and try to explain why and when this information is important. And I think once there's that transparency, that trust comes into play as well, because they know that whatever we do it in a very transparent manner and with the full collaboration of the whole of government and whole of society.
David, it would be great to get your reflections on this topic as well. I mean, how has Buenos Aires managed to build and to maintain trust? I mean, either prior to the crisis or during it?
Well, as I mentioned, citizen responsibility and involvement were essential for our crisis response and the switch on plan. Hence, keeping our citizenship in the loop and having a solid active communication strategy are key elements to promote the trust in and contain spread of the virus. Before COVID, our government already deeply connected with its citizens and implemented a great variety of open government initiatives to promote public access to information, active transparency, and citizen participation, as Bernard mentioned before. A significant proportion of our major weekly agenda was destined to meeting and listening to Buenos Aires inhabitants, to co-creating innovative solutions for our city's urban challenges, and bringing the government closer to citizenship. With the COVID outbreak, our proactive communication strategy proved to be our best ally. It is based on anticipation. We explain our measures before we carry them out. We announce these cases and developments before they are picked up by the press, and we communicate the result of these measures, such as the reduction in the use of public transport services, so that people know that the efforts are worth something and that everybody else is complying. Likewise, is developing a close relationship with our citizens based on trust to face the pandemic. Timing was essential. For example, in March, 4 days before we had our first confirmed COVID case, the mayor had already given a press conference to raise awareness, inform, and prepare the city for the imminent lockdown. Since then, our health minister, as mentioned before, gives press conference every day on the epidemiological status, and similarly, our mayor addresses citizenship every 15 days to inform reopening decisions and new measures related to the virus. Like I said, our policies heavily rely on evidence and opening data to our citizens to promote accountability, active transparency, and trust. We are an open government that believes the more information people have, the greater freedom and responsibility they will have to make decisions. In addition to publishing our response and switch-on plans, the city continues to issue daily epidemiological reports and has added a new open data platform with indicators on health management, mobility, and public space use, all of which guide government decisions. The key goals of platforms are to improve the decision-making process by providing real data on time, boosting active transparency and accountability, and allow citizen participation and active collaboration in the implementation of public policies. Given the pandemic, unprecedented characteristics, governments all around the world had to procure health-related goods and services that were not planned or approved in advance, nor they did have suppliers for, or suppliers could cover the growing demand. Following our active transparency tradition, we launched Compras Coronavirus, an online platform to disclose public procurement information related to COVID-19. Lastly, and considering the social distancing context, we needed to establish a collaborative network to aid the most vulnerable. And here, citizen participation was crucial to creating a big enough structure to leave no one behind. Since the lockdown started, more than 40,000 volunteers participating in various programs to assist and accompany the elderly during isolation or to carry out vaccination campaigns, among other examples.
Thank you. I definitely want to come back to those important ideas and findings about how citizens react and how citizens are willing to help. But I'd like just to turn first to you, Joe, to talk about communities. Now, you said New York is a city of communities. And I guess that those are both spatial communities and communities defined in other ways around other identities. As the COVID crisis played out, what were some of the key communities that emerged as being particularly vulnerable? And I'm interested in whether there were specific messages which needed to be communicated to those communities, or whether it goes beyond messages, that there were actually different sort of policies or interventions that were needed for particular communities.
I think one of the things that the COVID epidemic did was really reveal what was probably pretty well known to public health professionals and others, the enormous disparities within the city of New York, within many of the great cities of the world, and I think around the country, especially in New York City, communities of color, lower socioeconomic communities, I think have a particularly high burden of disease anyway, in terms of chronic disease and conditions in their communities that really don't help them achieve the highest level of health status they are capable of. And these were this reality put them at higher risk really for COVID itself. I mean, the data shows that individuals with pre-existing conditions, have been particularly vulnerable to the most severe cases of COVID and disproportionately at risk for death and disability. So, as I said, I think professionals were aware of these differences, but it really came to the attention of the public, intellectuals, public leaders, business leaders, others who perhaps had not been, and to some degree political leaders who've been more focused on their particular area of responsibility and not really looking at these broader issues. So I think the systems questions opened up that set of realities. So the most vulnerable communities I described are also the folks who depend on public transportation to get to their jobs. And therefore the issues that David raised about issues about the safety of public transportation were issues. They didn't really have much of a choice, I think, in many instances to decide, I'm not going to take the bus or the subway, I have to do it to get to my job. And similarly, we learned a lot about housing, sort of multi-generations of families living in housing, which is great on the social connectedness side, but may be a real problem both for spread of the disease, but also just the reality of, you know, kids wanting to have access to a computer, to work, to go to school virtually, and the parents who may be working from home, and the need to stay in touch with others when there's one device, you know, in the family or in the community. And we learned in upstate New York especially, and I think this is probably true in many rural areas, just basic broadband connectivity made it really difficult to connect certain populations to this new world of communication, these new mechanisms of communication. So I think we've seen how, and New York City was aware of these. I think we have a world-class Department of Health and world-class healthcare delivery system in the city. And our mayor has been, since he came in, very focused on the issue of equity and social justice. But, you know, it's not just access to healthcare, it's really changing conditions in communities that lead to problems with the opportunities people have to really, as Vernon said, exert control, take care of themselves, make their own decisions if they don't have access to the resources that others do. And that's a systems problem. It's a political leadership problem. And it's something that is, I think, very high on the agenda for New York City and New York State going forward. If we're all looking at lessons learned while we're trying to keep the current level of risk down, and to really use that to shape the changes that are needed in our system, and also to really address the disparities that have been strongly revealed to everybody.
David, can I turn back to you to explore a little bit more these issues of sort of vulnerable communities, and in particular, I guess, low-income communities, perhaps informal settlements, and people living in these multi-generational households and dense residential areas. If I understand correctly, Buenos Aires had specific policies that were directed towards looking after vulnerable members, particularly the elderly, living in these denser communities. Is that right?
Yes, very good question. In our experience, counting with the centralized management administration that builds its policies based on evidence was fundamental for tackling COVID. However, the undertaking transformation over a decade to a more resilient, inclusive, and sustainable city was decisive in providing aid to the most affected population, as you said, mitigating the long-term consequences that COVID will have in our city. According to the United Nations, 1,600 million students around the world were affected by the school shutdowns. Buenos Aires has been working to improve the quality of its educational offering year after year, implementing innovative educational policies to prepare children for the use of new technologies and the jobs of the future. This educational transformation has made it possible to continue the education virtually and to keep the entire educational community connected. Likewise, we have identified approximately 6,500 students that dropped out during the lockdown, and we established specific policies to bring them back to school. In terms of gender, for example, in terms of gender equality, experts state that the progress made towards women empowerment is in danger of being set back as a result of the pandemic. The city, in this case, redoubled the effort to prevent the deepening of gender gaps, together with experts from the United Nations Women and civil society organizations, we designed a strategy that focuses on social protection, employability, and caregiving tasks. Among other initiatives, every reopening protocol includes clauses of gender equality, aimed at recognizing the particular needs of male and female workers to avoid the reproduction of gender stereotypes and ensuring that men and women are able to work from home and or return to the workplace in equal terms. Further, the pandemic has accelerated many urban trends that do not only keep us on track to a sustainable and inclusive city, but also are sanitary safe. Evidence indicates that activities in public spaces have less risk of contagion. The COVID-19 crisis has given us the opportunity to strengthen our commitment to a city on a human scale. In other words, a city that puts people's quality of life at the core of government policy and aims to improve it, advocating climate action and sustainability mobility. Although we have been working on development, we mitigate the impact of the pandemic, still have many challenges to address. And one of the lessons we have learned from COVID is that those who put the sustainable development and resilience agenda as their priority are more likely to, or for that matter, the future climate or social economic crisis.
Thank you, David. Vernon, could I turn back to you and ask about different communities within Singapore? A lot of the cases in Singapore were concentrated in the dormitories of the foreign workers. And I guess that required specific both communications efforts, as well perhaps as in terms of the interventions and the kind of access to care for that particular group of people. Could you tell us a little bit about that and how it was addressed?
Yeah, and essentially, I mean, as you've mentioned, the focus of our interventions have been, through early detection, and that includes, good surveillance, testing, and identifying cases. And when we identify cases, we would then, perform our contact tracing and ring fencing to contain spread around those cases. And of course, once we identify cases as well, we will provide them with the appropriate, management, which could be in, community care facility or a hospital, depending on, the sort of severity of infection and risk factors and so on. So I think that has been the focus of trying to detect cases, prevent transmission as much as possible, and also to reduce complications by providing the appropriate level of medical care. And I think through that, we have actually managed to reduce the complication rates from COVID-19 in Singapore to a very low level through, I think, a combination of all of those things, including sort of good targeted clinical care and early intervention. So I think that needed to be, of course, communicated to the various stakeholders and also the COVID cases themselves so that they know that if they're infected, or wherever that they might be, whether it's in the community or in some of these migrant worker dormitories and so on, they'll be provided the same level of care that's appropriate for their respective condition. So that's the sort of strategy that we've set out to do. And I think we've been reasonably pleased that, over the months, we've been keeping our complication rates really low, and also at the same time managing to keep or to contain the spread of infection such that we are at a level now where the number of community cases is very low as well. And like I mentioned, we're trying now to achieve that balance in terms of getting the community to work together with us to maintain that low number of cases, even as we open up, society, economy, air travel, and so on.
Thank you, Vernon. So we just have a few minutes left for our discussion. It's gone by fast. And I would like to give each of you the opportunity to just talk about the future a little bit. How can we learn from this? What lessons are perhaps already being integrated and built on in the cities where you're working? And what would you like to see added to that or emphasized in that process? David, could I turn to you first, just for some short thoughts on what can be done better and what can be learned from this?
Yes, only a short observation, 1 minute. I think that the cooperation between cities and countries have been very important during the pandemic, maybe the most important in the last decades. And we had the opportunity between all of communities and all of governments focus, no matter what party or what politician party or color, all the countries and cities had the same problem, and they very focused to solve this problem. And the cooperation, I think, played a very important role. Maybe and to, of course, to develop a vaccine. Maybe we have to learn about this, and we have to use these examples to solve other kind of problems, maybe like climate change.
Thank you, David. Bannon, what are your thoughts?
So a few thoughts. I think one is that I don't think we can just rest on our laurels and say that, all the things that we've done over the past, 10 months for COVID is going to be exactly the same as how it will pan out over the next, with a year or two, whatever it is. I think we have to expect the unexpected, and I think the virus may, have some surprises for us. So I think the constant preparedness and being on our toes, I think is really important. Secondly, I think is the, use of new technologies and also collaborative platforms, which I think has been unprecedented during this this pandemic. The collaboration across countries and institutions and has yielded a lot of new technologies, whether it's technologies in diagnostics, surveillance, and also therapeutics like vaccines. The development of vaccines, I think, has been extremely rapid as well. So it's something that we are all waiting with bated breath to see, when a vaccine becomes available, how would that change our approach to dealing with the pandemic. But I think some things probably will still have to stay new normal as we ramp up vaccine production and try to vaccinate as many of the population as possible. Is that I think at the end it has to be a combination of therapeutics, of good public health measures, some of which might be here to stay for a while, and also good communications and education of the public on how they should adapt in living with COVID and keeping I think COVID rates as low as possible, so that they would not be adversely affected, whether it's their health or also society and economy at large.
Thanks, Ben. Joe, some final words from you, please.
Just let me endorse what my colleagues have said and just add a couple of points perhaps more unique to our situation. I think we are looking forward to greater coordination of evidence-based messaging between our federal, state, and local government going forward. This is a process that we are living through at the moment, but I think the available evidence is quite well known and the expertise is here. We just have to coordinate it better, and I hope the lessons would be learned going forward, that the importance of federal leadership in a situation like this, which is quite unique. Even if it isn't the norm in the United States, and I don't think it ever will be, it will be the norm in the public health world. Secondly, I think we need to really focus our investments, our post-COVID investments, in the communities that were most heavily affected by the disease. So the issues of looking at the infrastructure, looking at the pre-existing diseases, the opportunities that are in vulnerable communities, and put our money there first, put our problem-solving attention there first, so that we can really use this crisis to make the system better going forward. And then, as I said, we're looking very closely at what lessons can be learned from COVID. And I think they were mentioned earlier. We've shifted very, very quickly to the use of technology, televideo, telemedicine, which had been constrained by regulatory restrictions up to then, and then that was opened up. So we've learned a lot, I think, especially on the healthcare delivery system and in the connection between local government, state government, in terms of reshaping the new system, and in our healthcare delivery system, the financial incentives for our healthcare delivery system to really promote prevention, to promote this coordination and integration of services. So it's a tough time, but it's an exciting time, I think, as we look forward.
Jo, thank you very much. So I think it's a nice note to end on. Although it's a terrible global challenge, it's one of the very few genuinely global challenges for countries at every level of development, at every level of income, and every sort of industrial structure in every region. And the idea that might give us this opportunity to build cooperation, which might be sustained afterwards, and possibly cooperation that can then be applied to other global challenges, is a very heartening one in this very difficult time. And it's been absolutely wonderful to have three people united through technology in different bits of the world to discuss these very important issues. So David, Vernon, Jo, thank you very much indeed for sharing your thoughts with us and your experience. And I hope that we can come together once again in an easier time to think more about building back better and how to increase and restore international cooperation on some of these issues. And thank you all very much for listening.